The body of work reviewed in this article shows that paternal acceptance rejection, father love, is heavily implicated not only in children's and adults' psychological well-being and health, but also in an array of psychological and behavioral problems. Moreover, this body of work suggests that father love may affect offspring development at all ages from infancy through at least young adulthood. More specifically, evidence discussed here shows that father love is often associated as robustly as mother love with a variety of outcomes. For example, both father and mother love withdrawal, parental rejection, have been significantly implicated in offspring's personality and psychological adjustment problems, including issues of negative self-concept, negative self-esteem, emotional instability, anxiety, social and emotional withdrawal, and aggression, conduct problems, including externalizing behaviors and delinquency, drug and alcohol abuse, cognitive and academic difficulties, and forms of mental disorder such as depression, depressed affect, and borderline personality disorder. On the other hand, both paternal and maternal love, parental acceptance, have been shown to be effective buffers against many of these problems, as well as being associated with a sense of happiness and well-being in adolescence and adulthood, physical and psychological health, social competence, academic achievement, and the internalization of parental values as one's own values. Even though mother love is associated with all of these outcomes, evidence reviewed in this article suggests that father love is even more strongly associated with many. Moreover, multiple regression and SEM analyses conclude that the influence of mother love sometimes disappears altogether, leaving father love as the sole significant predictor of such outcomes as personality and psychological adjustment problems, conduct and delinquency problems, and substance abuse. Several problems and limitations characterize this body of research. First, most of the work appears to deal with middle-class European American parents. Research on the influence of father love among African Americans, Hispanic Americans, Asian Americans, and Native Americans is relatively uncommon, and it is equally rare in cross-cultural studies. As a result, it remains for future research to determine the extent to which results reported here can be generalized beyond middle-class European American families. Second, many of the studies reviewed here relied on a single source, e.g., youth or parents' reports, to provide information about both parental acceptance rejection and the relevant outcome variables. As noted by Campbell and Fisk, 1959, Marsiglio, Amato, Day, and Lamb, 2000, and others, however, shared method variance in studies such as these might artificially inflate the correlation between variables, resulting in an overestimate of the true effect size. Third, even though it seems unmistakably clear that father love makes an important contribution to offspring's development and psychological functioning, it is not at all clear why paternal acceptance rejection is sometimes more strongly associated with specific child outcomes than is maternal acceptance rejection. And it is unclear why patterns of paternal versus maternal parenting are sometimes associated with different outcomes for sons, daughters, or both children. Part of the reason for these differences no doubt lies in the fact that fathers and mothers often interact with their children in somewhat different ways. Faggett, 1995. Fathers generally interact with children less frequently than do mothers, for example, and they generally tend to be less involved in caregiving. Faggett, 1995. K. N. Harris et al. 1998. Moreover, when they do interact with their children, fathers often initiate different types of behaviors from those of mothers. For example, fathers tend to engage in more physical, rough and tumble, and idiosyncratic play than do mothers. Collins and Russell, 1991. Forehand and Nisainen, 1993. Park, 1996. In addition, fathers are more likely than mothers to encourage children's competitiveness and independence, and to encourage their children to take risks. Cabrera et al. 2000. Nothing in these behaviors per se, however, appears to explain why father love sometimes has different effects from mother love. Possibly, evolutionary and behavior genetic influences should be considered in attempts to explain some of these effects. Collins, Macoby, Steinberg, Hetherington, and Bornstein, 2000, 2001. J. R. Harris, 1998. Rowe, 1994, 2001. Some of these differences, however, are probably related to the fact that fathers are often perceived to have more power and authority within the family than do mothers. Radin, 1981. It remains for future research to inquire directly about the relevance of these mechanisms. Until then, we can know that father love is often as influential as mother love, and sometimes more so, but we cannot know for sure why this is true. Proper recognition of the influence of fathers and father love should have several salutary effects. First, widespread recognition of father's influence may help motivate many men to become more involved in nurturing childcare. Simons, Whitbeck, Conger and Melby, 1990, supported this point when they found that fathers are more likely to engage in nurturing activities when they believe such behaviors will make an important difference in the life of their child, page 387. Of course, the degree to which men are likely to become involved in nurturing paternal behavior is at least partly a function of their mates' internalized cultural beliefs about the maternal role, Park, 1995. That is, because of the enormous cultural emphasis placed on the role of motherhood in America, some women are ambivalent about encouraging fathers to become heavily involved as nurturing parents. Allen and Hawkins, 1999. Biller, 1993. Cowan and Bronstein, 1988. Doughty et al. 1998. Marsiglio et al. 2000. And of course, as already mentioned, some men have difficulty redefining masculinity to include nurturing paternal behavior. Nonetheless, the evidence seems clear that mothers are more effective parents when fathers are both supportive partners and nurturing parents. And children are major beneficiaries when both parents are warm and loving. The second salutary effect of widespread recognition of the influence of fathers and their love should be to help reduce the incidence of mother-blaming common in the clinical field. That is, according to Fairs, 1997, and others, Kaplan, 1986, 1989, Kaplan and Hall McCorquodale, 1985, Fairs and Kompers, 1992, the great emphasis on mothers and mothering in clinical research and practice without examining the influence of fathers and fathering has led to a tendency toward blaming mothers for children's maladjustment and psychopathology. The emphasis in this review on fathers should not be construed to suggest that mother love is generally less important than father love. Indeed, some studies discussing the effects of father love relative to mother love conclude that mother love has greater influence than father love for specific developmental outcomes. For example, in the meta-analysis of 15 studies dealing with a relation between gender of parent and youth's externalizing behaviors, Rothbaum and Weiss, 1994, found that the correlation between caregiving and externalizing was larger but apparently not statistically so for mothers than for fathers in 80% of the studies reviewed. According to a related meta-analysis of the relation between caregiving and conduct problems delinquency by Lober and Statham-Lober, 1986, however, 64% of the 75 studies reviewed reported that fathers' love-related behaviors had a stronger association with these child outcomes than did mothers' behavior. Evidence such as this punctuates the need to include both fathers and other significant males, when appropriate, and mothers in future research, and then to analyze the data for possible father and mother effects separately. K. N. Harris et al. 1998. It is only by separating data in this way that behavioral scientists can discern when and under what conditions paternal and maternal factors have similar or different effects on specific child outcomes. Cole and McPherson, 1993, and many more. This call for separate measurement and analyses of maternal and paternal influences is contrary to the argument made by some, Kerdek and Fine, 1994, and many more, that behavioral scientists should combine mother's behavior and father's behavior into a single composite index. Beyond this, evidence cited in this article makes even more compelling the call by Silverstein and Fairs, 1996, and others, e.g., Jesser, 1993, Kerr and Bowen, 1988, Park, 1995, Fairs, 1996, to transform the dominant theoretical paradigm in the social sciences from a dyadic i.e., mother-child to a triadic i.e., father-mother-child, or larger systems model. Silverstein and Fairs, 1996, page 48. This transformation would include a paradigm shift in guidelines for conducting research, as well as in graduate training and clinical programs, to automatically include fathers as well as mothers in all parenting matters. In addition, this call recognizes the need to explore social policy implications of research showing the powerful influence of father love as well as mother love. Finally, we should note that many questions remain unresolved and even unexplored in the research literature assessing the relative contributions of mothers and fathers' love and love withdrawal. For example, little is known about the question of whether children might be differentially affected by mother love in comparison with father love at different ages or at different developmental stages. Similarly, it is unclear whether the magnitude of the effect of mother love or father love varies across offspring's lifespan. And, as already mentioned, little is yet known about why the influence of father love is sometimes greater than the influence of mother love. Answers to these and many other such questions await future research.